Report from Germany on the corona crisis. First of all, I have to mention that maybe in every other country, the number of patients receiving intensive care is increasing again. While there were 2,061 COVID-19 cases in intensive care on November 1st, there were now 4,179 and 2,500 were ventilated on December the 7th. Of course, the increase is accelerating. Within the last 4 weeks, the number of patients undergoing intensive care treatment has risen by nearly 100%, and maybe it's the same in other countries. And you can see in October 19, the figure was 851. So, and 369 of them were ventilated. So it's increasing a lot. Lack of staff is becoming the main problem in the corona crisis in Germany. We have at the moment a shortage of 30 to 40,000 nursing staff, and in 10 to 20 years there will be hundreds of thousands, maybe 300 or 500,000 lack of staff in Germany. Now, when we in Germany not only need more staff in the face of corona crisis, but also specially trained intensive care or disaster nurses, the lack of staff in the care sector becomes more than obvious. So there is a pressure to act, and the pressure to act is just rising again with the second wave and maybe the third wave of corona in the next months. Hospitals created new capacities, maybe in other countries as well, in intensive care units. However, experts assume that the shortage of nurses in the hospitals will soon become massively apparent. But then, one nurse would be needed per seriously ill COVID patient in the intensive care unit. It is currently estimated that there is a shortage of 3,500 to 4,000 specialists in intensive care throughout Germany. So, another point is that nursing professionals feel inadequately prepared in Germany. Especially in the corona pandemic, nurses in direct care are exposed to extraordinary professional stress. Tina Venema and other colleagues mentioned that before. Many nursing professionals feel inadequately prepared for this situation because we never had this before, and are therefore exposed to numerous risks, especially that of infection, of course. So nursing homes, especially nursing homes and hospitals, have been able to use rapid antigen tests since October to regularly test staff, visitors and patients, and of course residents for coronavirus. During the extensive restrictions in the spring, employees suffered from a lack of protective equipment. Even basic mouth-to-nose protection was not available in a lot of nursing homes and hospitals. 2/3 lacked this safer FFP2 or FFP3 method. Researchers at the University of Bremen had announced in the spring that the proportion of nurses infected with COVID-19 was 6 times higher than in the general population. That's a lot. So far, 85, that means on December the 3rd, employees have died, mainly from institutions such as hospitals and nursing homes. Employees means mainly nurses and some doctors, of course. Especially nursing facilities are particularly affected with 55 deaths of more than 25,000 infected employees. And we have just a big discussion in Germany because nurses will still be deployed. The summer has not been sufficiently used to prepare for coping with the second wave of the pandemic. For this reason, politicians in Germany are now deciding, despite a corona infection, nursing staff will have to go on duty, if necessary, to care for the increasing number of COVID-19 patients. Remember the shortage. If the supply, for instance, in a hospital breaks down, it would be the relapse physician, so the Minister of Health, Ministry of Health, Jens Spahn, to let the positively tested ones work with special safety precautions also. And next point, which is just discussed in Germany, is work time in hospitals were extended up to 60 hours, especially for nurses and doctors. And with sharp criticism, the president of the German Nursing Council, Franz Wagner, rejects many of the measures now taken as completely misguided and absolutely indisputable. Thus, in Lower Saxony, a part of northern Germany, by order, the possible work time in hospitals was extended up to 60 hours. And that is politically shabby, Franz Wagner explained last week. He is just as critical of the fact that infected, symptom-free nurses are supposed to work in certain situations. So the professional nurses need occupational and health protection more than they have now. So the conclusion is that nursing seems to be one of the most dangerous professions in the world now. The World Health Organization reported more than 1.3 million infected physicians and nurses worldwide in mid-July. This represents about 10% of all global COVID-19 cases, 10%. The International Council of Nurses, ICN, had recorded more than 230,000 infected nurses worldwide in an analysis in early June. More than 600 caregivers have died so far, but it's in June, so maybe today we have a lot of more nurses who died. So another conclusion is that the German Nursing Council misses a clear concept. In the view of German Nursing Council, it is essential that the nursing profession and its expertise be integrated into the decision-making processes at an early stage and not just when it is once again too late. If we have a discussion in Germany on the intensive care units and the problems they have, in the television you have interviews with doctors but not with nurses. And the doctors, they speak about the shortage of the nurses. So it's crazy, and that is what means as be integrated in the decision-making process. So thus is not understood that the representation of the nursing profession is not involved in advising the Federal Ministry of Health on the corona pandemic. Franz Wagner said, in times of crisis and beyond, this is a no-go. So my conclusion at the end of this short report: coping with the corona pandemic requires professional caregivers to perform superhuman tasks that go far beyond the limits. It is not difficult to see that we in Germany still have a lot of work to do in many areas, and that we need to learn more in order to put nursing as a profession at the top of the political agenda. And it's very hard to do that in Germany. I very much hope that we have learned something new in the face of the corona pandemic, and that politicians have understood that nothing will work in future without the nursing profession. I hope that very much. And now I try to show you a video from a hospital, not in Germany because they would speak German, but it's a hospital in New York. And I hope that the video is working now. Just a moment.
So about 10 days ago, we had a husband and wife come in through the emergency room. The husband was extremely sick and had to be intubated and put on a vent, and he was sent to the medical ICU. The wife ended up also getting sick, and she was put on the step-down unit, and they were apart for 10 days. They weren't allowed to see each other, and the husband was in critical condition. As of today, both the husband and wife are recovering. and they're in the same room and hopefully going home soon. Emergency room doctors and nurses have been seeing extremely sick patients come through their ER department in these last couple of weeks, and they intubate them and send them off upstairs in the hospital, and they have no idea how they are doing. And they know that I am a float nurse, so I work up on the floors, so I see those patients, and they're constantly asking me how their patients are doing. You know, they remember every single one of their patients that they have intubated. So I came about with the idea for a hope huddle so that we could share the good news of these patients who are able to get extubated and off the ventilator.
To hear from her late last night with this amazing idea, just, you know, once again makes me think so much of her and the way she thinks about her coworkers and her patients.
Spreading a little hope is everything to the doctors and nurses right now. You know, we're really desperately trying to see the light at the end of this tunnel.
In the last couple of days, we had, 5 patients that came off of respirators. The staff was cheering. So it was actually like a celebration.
And it's just a time of camaraderie, and we're all kind of rallying together and just checking in on one another and making sure that we're taking care of ourselves as well as taking care of everybody else.
These are really scary times. It's scary to see the patients come in so sick. So I think if we start to hear the positive outcomes that we are achieving here at Lenox Hill, and if we hear that the patients are getting better, they're coming off the ventilators, and they are getting sent home, that will give all of us a little hope and a little light that we need right now.
We'll get through this, and we're going to get through it together.
Okay, so thanks to all nurses in the world, and thank you, dear colleagues, very much for organizing this conference, and thank you for your attention.